So folks, I'm really excited to engage in this conversation with you, and that's saying a lot considering that I have done this particular training, I would say over 300 times. And what that can hopefully communicate to you is I really never get tired of talking about motivational interviewing with people in the learning community. Because as we talk about this and as we practice this together, it's like all boats rise. We all get to grow and learn. So I really appreciate that opportunity, and I want to thank you again for being here. I will share my screen and we'll take care of a couple of other logistics, and then we will start moving into this particular content. All right. So again, this is part one of the theory and practice of motivational interviewing. And I'm Paul Warren. For those of you I haven't had the opportunity to be in a learning community conversation with, I'm a social worker by training. I'm also a member of the Motivational Interviewing Network of Trainers, which is an international organization. And I'm also a senior staff trainer and curriculum writer for the Northeast and Caribbean Addiction Technology Transfer Center. And those of you who know me, and I just stopped sharing my screen to make this point, those of you who know me know what I'm about to say next, which is that there have been times when I've been forced to go to Puerto Rico and St. Thomas in person, yes, Gloria, in person, to train. So, but I will tell you on this Friday, I'm very happy to be here with all of you, and I haven't been forced to go to Puerto Rico or St. Thomas for a very long time. So they have very capable trainers there. They don't need me. So I'm going to go back and share my screen again. Also to let you know that as we engage in this learning community conversation, we do have a couple of guidelines, and probably the first, and yeah, Charles says, my heart still hurts for you for having to do this. And sure they do. Yes, they definitely do have very, very competent trainers in Puerto Rico and St. Thomas and St. Croix. And I'm glad that you have such empathy for me, Charles, because that's perfect, especially for the topic of motivational interviewing, because empathy is key to the effectiveness of motivational interviewing. So as we engage in this learning community conversation, and we have about 40 people in the learning community now. It says 44, but there are also my colleagues, so maybe 41 people, because there's myself and two of my colleagues, Clyde Frederick and Tree Chapel, who actually make it possible for these learning community conversations to happen. So many thanks to both of them for making this opportunity happen today. As we engage in this conversation, please keep in mind that how we speak to each other in our time together, it matters. And we want to be using language that is inclusive, respectful, and supports and advances recovery. Also, because this is a learning community conversation, meaning you're going to be invited to talk about your experience, what you know, what you believe, what you feel, your understanding of this evidence-based practice, and I'm going to be sharing with you from the content that I have and that has continued to grow over the years, that we may not, as we engage in this conversation, reflect the official views of our funder. And that's okay, because that's the normal outcome of a viable and meaningful learning community conversation. And I'm going to go back to the slide for just a minute, because I want you to see this visually as I'm reinforcing it with my voice. But I'd like you to consider that there is a particular goal in mind for this learning community, this two-part learning community conversation. One is certainly to provide an overview of motivational interviewing. Now, I will add that I'm 100% confident that there are about 20 or 30 people in this learning community right now who could give an excellent overview of motivational interviewing. And that's great. The purpose of this course is to provide an overview so that we all have shared language. And what I can tell you is that this content reflects the most current edition, and actually the forthcoming edition, of Bill Miller and Stephen Rolnick's book on motivational interviewing. The 4th edition is going to be published this year, but this training, this learning community conversation, reflects the most updated information in regard to the practice of motivational interviewing. So this is an opportunity for us all to be updated and to be on the same page. Oftentimes, trainings around this evidence-based practice stop at the overview. And what I believe and what I've experienced in regard to my journey with this evidence-based practice, which started in 2003, is that you can't really, having an understanding of this evidence-based practice, being able to give an overview of it, does not mean that you can actually do it. And this is a rubber meets the road issue, because motivational interviewing is an evidence-based practice that can help people to change their behaviors. There is an intention behind it. There is a very robust evidence base that shows that if you practice motivational interviewing, if you do it the way it's prescribed, you can actually help somebody reduce their ambivalence about a particular behavior change, and you can actually help that person to strengthen their motivation or motivations to want to make that change. And what I want to make very clear from the beginning of part 1 of this conversation is that understanding that is not the same thing as doing it. And MI is meant to be done. So it is a practice. And my hope is that in our 2-part conversation and the week that is in between the 2 parts, that you will be thinking about this from an intellectual perspective, but you'll also be thinking about it from a practice perspective in terms of putting it into action. And I'm going to add one other thing, and then we're going to go forward with the slides with just a couple of learning objectives. And that one other thing, and I'm going to make this statement, but then I'm going to ask you to comment on it. So I'm preparing you to unmute to comment. Practicing motivational interviewing is much more than just using the skills, the communication skills. And I'm going to give a concrete example. And this is something I'd like you to comment on. And after I cover the learning objectives, we'll have a little bit of a conversation about this. Just because you may ask an open-ended question does not mean that you're actually practicing motivational interviewing. Just because you do an affirmation or a reflection or a summary does not mean that you're actually practicing motivational interviewing. So that's what I'd like us to come back to after I review these learning objectives. And I'll repeat it when we come back to it, but I'd like to have your thoughts or your comments in regard to that particular statement. Just using open-ended questions does not mean you're actually practicing motivational interviewing. So we're going to come back to that. So put a stick pin in that, and we'll be back to it in just a moment. My hope is that when we've completed part 2 of this learning community conversation, you will be able to define and list actually what constitutes or what makes up the practice of motivational interviewing. I'm also hopeful, and I'm sure that there are people that could do this already in our learning community, and that's great. And I'm so glad you're here, because this is part of the overview piece of it, is that you will be able to state and describe the 3 core central pillars of the practice of motivational interviewing. And P.S., I just mentioned one of them when I was talking about the communication skills. You'll also be able to talk about and describe the relationship between motivational interviewing, client-centered counseling, and the trans-theoretical model of change, or the stages of change model. Now, let me just say, these are three separate things. MI is not client-centered counseling. It is not the trans-theoretical model of change. And there's often confusion about the relationship between these three things, and they are not the same. They all have a relationship, but they're not the same. In fact, and this is just a brief aside, Bill Miller and Stephen Rolnick wrote a wonderful article called "The 10 Things MI is Not." And it addresses this very issue of MI, client-centered counseling, which we have Carl Rogers to thank for, and the trans-theoretical model. Now, I'm going to ask you to use the chat that if you have read the article, "The 10 Things MI is Not," type a Y in the chat. And because I'm an equal opportunity chatter or texter, if you have not read the article, "The 10 Things MI is Not," type an N in the chat. And if you're unsure that you've read the article, type a U. So 9 people have responded, and we have over 40 people in the learning community. Let's get everybody to respond. And I see that there's some questions in the chat, which I will look at in a moment. But I see that 29 people have responded. Oh, wonderful. So a number of people, oh, yeah. Many people have not read this article, and some people are unsure. Paulette has not read it. Okay, thanks, Paulette. Laura has not read it. Okay, well, I want to suggest, and maybe we can make it available to you. Jaime has read it. Wonderful, wonderful. I'd like to suggest that if you have not read it, that we can make it available to you in between, and maybe you can read it. It can be very helpful. The other thing to keep in mind, folks, is that I would hope that you'd be thinking about, in the practice of motivational interviewing, and I'm going to make a statement here that sometimes terrifies and shocks people. Terrifies is maybe too strong of a word. Unnerves is maybe a better way to put it. But sometimes when I say this, people are like, what? But what I'm about to say is that there is no script for the MI conversation, because what you say next depends on what the patient or the client has said before you. So you can't, there are transcripts, of course, but you can't really give somebody a script as to what they're supposed to say. So this bullet here, state the rationale for choosing one core skill over another related to a specific moment in an MI conversation. If there's one thing that you walk away with from our conversation today, please walk away with this. There's not any one right way or response to practice motivational interviewing. It depends on the individual, what's going on in the moment between you and the client or the patient. And it depends on, subjectively, what you, as the provider practicing motivational interviewing, or the person engaging in the conversation, what you think may be important to emphasize at that particular moment. So if you came here expecting that there was going to be a script, I'm sorry, there's not going to be a script. There are core communication skills, but we use them, and I'm going to throw a word in here that I'd like you to remember. We use them intentionally, based on what's going on in the conversation. And I'll just add one other thing here, that not every conversation is an MI conversation. MI is not for every conversation. And we're going to come back to that in more detail as well. So hopefully what you will get a sense of through our time together is demonstration on the selective and the intentional use of motivational interviewing. So that's what I hope we'll accomplish. I know it's a robust set of learning objectives, but that's what I'm hopeful we will accomplish during our time together. So before I invite you to do these introductions, I'm going to stop sharing my screen. And I want to go back to what I posed to you earlier to consider. And you may be thinking, well, he said a lot since then, so I don't remember exactly what he posed for us to think about. But what I did pose for you to think about was, just because you're using an open-ended question, an affirmation, a reflection, or a summary does not necessarily mean you're practicing motivational interviewing. That's what I asked you to think about. And I'm wondering if anybody would be willing to unmute and sort of share your reaction to that, or why, what your thoughts might be about that particular statement. That just because you may choose to use an open-ended question, and we know open-ended questions are part of the OARS, O-A-R-S, toolkit of motivational interviewing. But simply asking that open-ended question doesn't necessarily mean you're practicing motivational interviewing.
Without empathy.
Yeah, go ahead, Vanessa, please.
With the lack of empathy. Empathy is number one.
Okay, so Vanessa is really connecting us to sort of how we want to be practicing. And Vanessa, it's possible that somebody could ask an open-ended question in a not empathetic way, and that wouldn't be MI. Vanessa, right. I'm gonna throw something out in regard to what you said, and I'm very curious about your reaction, which is that you can ask an open-ended question in a very empathic way and still not be practicing MI. Any thoughts about that? It could be filled with buckets of empathy and you're still not practicing motivational interviewing.
I think it goes back to what you just shared when you talk about it being selective and intentional based on what's going on in the moment. So long as those are included, I think.
Okay.
Works, yeah.
Okay. Gloria, you are definitely on to that. It does have to be selective. It does have to be intentional. There also has to be another piece, but you're absolutely right. It has to be selective and it has to be intentional. If you're asking that open-ended question, there has to be an intention behind it. And the question should be selective for a particular reason. So Gloria is absolutely right. And Vanessa's right too. Yes, you do want to be doing it with empathy. Tiffany, what were you going to say?
Well, I was going to say exactly that, the intent of the question, because I'm thinking that we probably want to get the person, I guess, warm to start thinking about, and they don't know it, but, because again, the purpose is to start changing their thought process, or at least to get them open. Okay. If that makes sense. Yeah.
It makes complete sense. And what you're really talking about is you're talking about building rapport and helping them to be thinking and considering something. And it's so interesting. And I love that you added that. And Clive, I see you. Don't lose your thought. Okay. Don't lose your thought. The thing that I think is so interesting about what was just added, that Tiffany just added, is that it is about helping the person to open up to the idea. Okay? And what I want to tell you is I've listened to many audio recordings, quote unquote, of MI conversations where people have asked open-ended questions with lots of empathy, and that were open-ended questions that really like opened up the conversation, and the person still was not practicing motivational interviewing. So go ahead, Clive, ball in your court.
Good morning, all.
Morning.
Hi. I'm a KSAC. So I've done I'm a KSAC T. I'm putting in some work. And I realized that, I've done a few treatment plans, and I realized, if you let the client, if you let them talk, they'll eventually, if they talk long enough, they'll eventually answer their own questions, which leaves us with open-ended questions. It leaves us with, they're pretty open-ended. They're in the abstract, and they really haven't looked at what brought them, to that conclusion. They may not realize that they've answered their own questions. So I'm seeing motivational interviewing and as a way of having, giving them, having them look at the catalyst and having them look at, the reasons that, that they're sitting in my company, per se. So I think that motivational interviewing is definitely a great tool, and open-ended questions don't always get to the root of, it doesn't always allow, the person on the other end, the client, to realize that that they may have, or that the answer is available somewhere, and that they can come to the realization what that answer is at some point, at some juncture.
Excellent. Thank you, Clive. And, I want to underline two things that Clive said, because you're really touching on two essential elements of the practice of MI. One is that MI, as a practice, we walk in believing that that person probably has their own answers. They have their own insights into this. It's not necessarily about us pushing something on the person. It's about us drawing something from the person. And Clive is right on the money with open-ended questions, in the sense that letting the person talk, they sometimes will come up with their own answers. And they'll come up with their own plan, because you mentioned treatment plans. They'll come up with what they think is the next right step in their plan. And MI is about intentionally guiding that conversation in order to help that person find their motivations and to reduce their ambivalence. Now, a couple of people put some things in the chat, and I want to read what they put, because I think they were responding. So Jaime writes, it depends on the context of the conversation. Absolutely true. Allison writes, attending behaviors and body language should be included in MI. Absolutely. You want to be looking at nonverbal communication. Hanali writes, intent is to understand where they are. Absolutely true. That is essential to motivational interviewing, that we are listening to understand, not to speak necessarily. And Paulette, bing, 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 bing. I want to underline what Paulette wrote in the chat. Please, everybody, look at what Paulette wrote in the chat. Paulette writes, and I believe this is a question, Paulette, isn't it also illicit behavior change? Yes. And Jaime writes, listening to change talk. And it's change talk related to a behavior change. Paulette, would you be willing to unmute and say a little bit, and you can pass. If you don't want to unmute, you can pass. But would you be willing to unmute and say a little bit about bing, 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 behavior change?
Okay, I'm not sure I'm the best person for this, but we're sort of establishing a therapeutic alliance with the client. And
Yes.
you know, the MI or the conversation, the intentional conversations, the deliberate questions or the deliberate open-ended question is all about that, to elicit this change and to also let the client, patient, client, whichever terminology you wish to use, feel comfortable enough to know that we're in a partnership. So that's basically it, in a partnership.
So Paulette, you are touching on,
Thank you.
MI, folks, when you are practicing MI, and let's make a very clear distinction here. You can interact with somebody in an MI consistent way. That does not mean you're practicing MI. And we're going to distinguish between these two. Practicing MI, I want to link that to what Paulette just said. Practicing MI is when there's an identified behavioral change goal and you are intentionally and selectively, with empathy, as Vanessa said, using the core communication skills, open-ended questions, affirmations, reflections, and summaries. When you're intentionally using those core communication skills to reduce that person's ambivalence about making or moving toward this change, and helping that person to identify and strengthen their motivations for that behavioral change. And back to what Jaime said about change talk. Let's say James, hello James, good to see you. Let's say that James is considering a particular behavior change. And let's just say for the purposes of this particular conversation, James is considering walking 30 minutes a day to improve his cardiovascular health. And that's the change that he's considering. And he's ambivalent about that change. Part of him wants to make the change. Another part of him doesn't want to make the change. Okay? But that's the identified behavioral change goal. If I'm going to ask an open-ended question, I'm going to ask an open-ended question that helps me to understand where James is with that particular behavioral change. If I'm going to affirm, if I'm going to acknowledge a strength or an effort that James has made, I'm going to affirm or a strength and effort that relates to that behavioral change. If I do a reflection, I am going to reflect the change talk, and I'll define what that is going forward. I'm going to reflect and employ the change talk that is in favor of that behavioral change. That's the selective and intentional nature of it. And I'm going to do the same thing with a summary, folks. I'm going to summarize everything that is going to reinforce and strengthen James's desire, ability, reason, or need to make this particular change. That's the practice of MI. And I want to go back to something that Paulette said, because without this thing that Paulette said, you can't practice motivational interviewing. So Paulette is bringing great insight to this. And Paulette, you used a word that is central to the practice of motivational interviewing. Can anybody imagine what that, or remember what that word was that Paulette used?
Elicit.
That is a good word, Marcus.
Oh.
And that is definitely what we're doing when we practice motivational interviewing, but we can't elicit until we've established that other word that Paulette used, because she did use elicit, and that's absolutely right. But what's the another word that she, and Paulette's thinking like, what did I say? But what is, she did say therapeutic relationship, she did say therapeutic alliance, but she used another word that describes the same thing.
Partnership.
Vanessa, please say that one more time.
Partnership.
If you didn't hear Vanessa say that, I'm going to ask her to repeat it once more.
Partnership.
Vanessa, thank you so much. Your check is in the mail. It's very small, but it's in the mail. He said partnership, and you heard Vanessa say it 3 times. Thank you so much, Vanessa. You're a very good sport. Thank you. She's like, I'm keeping my eye on you, Paul. So Paulette has touched on the heart and motor of motivational interviewing. It is establishing that good job, Vanessa. I agree with Charles. It is establishing that partnership. And then you can do what Marcus suggested in regard to eliciting. But without that partnership, and let me give you a visual, and I'm dedicating this visual to Paulette and Vanessa. Partnership. This is partnership. It's 2 people having a conversation. That is partnership. This is not partnership. This, Paulette and Vanessa have given us, this is partnership. That is the approach. That is the empathy. Thank you again, Vanessa. That is the empathy that we want to bring to the collaborative partnership of this conversation. I have a very brief story to tell you. Bill Miller, one of the creators of MI, has said, and I verified this, because it used to be said all the time, and I was like, I need to find out if this is true or not, but it's true. Bill Miller has said, if I could go back and change one thing about motivational interviewing, I'd change the name. I'd call it motivational conversation. Because interviewing implies, Nathan, where were you on December 6th, 1922? I mean, I don't think Nathan was born then. But if that is what interviewing implies, I'm going to pepper you with questions. Bill Miller says, if I could go back and change one thing, I'd call it motivational conversation. Because it's a conversation to build a collaborative partnership. And in the presence of an identified behavioral change goal, you can evoke or elicit, like Marcus said, and you can practice motivational interviewing. But until there's that identified behavioral change goal that the person feels ambivalent about, you're not practicing MI. You're engaging in an MI consistent way, hopefully. Okay? The practice is when there's an identified behavioral change goal. That you are helping to explore the ambivalence and reduce the ambivalence. I want to, I don't want to. And you are helping to strengthen and identify the motivations. Yes, go ahead, Clive, please.
I want to mention, I know I agree, the word interviewing itself, it denotes that there are 2, there's a defined, there's a defined boundary, the client, the interviewer. So, you know, that's what, you know, motivational interviewing, I don't think, you know, I'm glad that, you know, we don't go in, you know, it's discussing that we're going to have a motivational interview. It's like I mentioned, it's a great tool that we're learning, that we're gonna or be brushing up on, that we're gonna, you know, that will hopefully grow from, that teaches us how to be able to speak to the client, right, and hopefully get what we need to get from them to be able to best assist them, without them realizing that that's what's being done. That's really what I want to say.
Yeah, and you know something, I'm glad you said that, Clive, because nobody has said this yet. Yes, and Allison is absolutely right. Interviewing implies a power dynamic, an imbalance as well. Absolutely. And guess what, folks? Let's pause on power dynamic, and we're going to come back to what Clive just said. But let's look at power dynamic for a minute, because who's going to make the change? The client, not you. So they're the one with the power. They're going to make the change. So let's work with their motivation to want to make that particular change. And, you know, Clive, I'm so glad you said what you said, because sometimes when people think about motivational interviewing, they think about, well, isn't motivational interviewing actually just manipulating the person? And let me say to you, no, it is not. And I can be very definitive about that, because we're engaging in a conversation with someone. We're not doing something to them. We're not going to do motivational interviewing on them. We're going to engage in a conversation with them. And motivational interviewing, and let's be very clear about this too, because this is a myth that's often associated with MI. People think, well, MI, it's an evidence-based way to get the client to do what I want them to do. It is not. It is an evidence-based way to position yourself, thank you, Vanessa, thank you, Paulette, as a collaborative partner. And in the presence of an identified behavioral change goal that the person feels ambivalent about, you can evoke, thank you, Marcus, their desire to make this particular change, their ability to make this particular change, their reasons to make this particular change, or their needs to make this particular change. And by doing that, and then putting to work what they may share with you, and we'll get into that in part 2, putting to work what they might share with you, you can actually help that person to move toward change and actually to make a change, to identify a plan, thank you, Clive, and to follow through on that plan. The evidence supports that. Okay? So I'm going to ask you to use the chat at this particular moment. So using the chat, and we have now 47 people in the learning community, which is great. I'm going to ask you to use the chat. And if you were going to describe your knowledge, 1 being motivate, I thought that meant myocardial infarction, heart attack. Or 5, oh, Bill Miller and Stephen Rolnick and I are talking about the difference between a complex affirmation and a simple affirmation. If you were going to put your knowledge level about motivational interviewing into the chat numerically, and we have, 47 people in the learning community, and so far, thank you, Brian, you're a leader. Brian has led the way with a 4. Excellent. So just qualify where you feel you are, and we have a wonderfully wide range, which is extraordinary and wonderful. And I'm going to invite everybody to put that into the chat. I often think of 3, Sylvia, I saw that you put 3. I often think of 3 as the Switzerland of MI knowledge, because it's right in the middle there. It's right on the center, which is great. Excellent. Okay. Now, I'm going to invite a few people also to unmute. And Autumn, I don't know if you'd be willing, if I could invite you to unmute and comment on this. And again, you can pass if you'd rather not, but I'll ask the question first, then you can decide if you want to pass. So I prefer like informed decision-making, which is this. When you think about motivational interviewing, what's the first thing that pops into your head? And there's no right or wrong here. It's just whatever pops into your head.
how am I going to appropriately document my motivational interviewing skills? That's the one thing that
Fantastic. Thank you. And you know something, Autumn? I'm positive that you are the only person that thought of that. I'm totally positive you're not. Yes, yes. Vanessa, I see that you're unmuted. What's the first thing you think of?
Stages of change, where a person's at.
Okay, so where that person is at, stages of change. Gloria, what do you think? What's the first thing you think of?
I think about my clients being stuck and how do I move them forward?
Yep, that they're stuck. And Jaime, I see you're nodding your head as well. Like, how do we move folks forward? Marcus, any thought? What do you think of when you think of MI? What's the first thing you think
of? Really like talking or motivating people, not necessarily to change, just motivating them and empathizing, you know.
Excellent. And you know, Marcus, I don't know, I didn't read your mind, but I'm so glad you said what you said, and I'll tell you why. Because you're not alone in thinking that. People think like motivational interviewing. Well, I'm going to motivate this person, right? I'm going to engage in a kind of conversation where I'm going to motivate this person. Marcus, I have something to tell you.
Okay.
Are you ready?
Yeah.
I'm telling you and I'm telling everybody else. When you're practicing motivational interviewing, you don't motivate the person to do anything.
Yeah.
Your job is not to motivate them. Your job, and Marcus, you actually said this earlier in some ways, or actually Clive said it. Clive said giving the person the space to talk.
Yeah.
Marcus, some people actually describe MI as it's a method of guiding a person to talking themselves into change.
Oh, yeah.
So they motivate themselves. So anybody who shared Marcus's thought about like, okay, you're going to practice motivational interviewing, you have to motivate the person, please take a big sigh of relief because you don't have to do that. Your days of having to motivate them using MI are over. Okay? So yeah, go ahead, Tiffany, please.
Yeah, I just completed an assist suicide intervention training.
Yeah.
And the number one thing, you know, that I drilled into my own mind, of course, as helpers, is that we're not trying to save anybody, but we are intervening so that they save themselves. So it's the same exact thing, you know, like I had put resistance. I had put resistance because I'm the first way I look at it is, okay, this person is not going to want to participate, right? That's why, like you just said, we're motivating them. But no, it's just to let them know, even if there is resistance, that they are the one who even controls the level of resistance to the point where they choose to remove it or, you know, or leave some of it there just enough, you know, but it's all about putting it into their hands.
Yep, absolutely. It's letting them be in the driver's seat. And I want to underline, and Tiffany, thank you so much for adding that. And I want to underline something there because I don't want you to misunderstand that because you're not motivating them, you're not doing anything. You are working when you practice motivational interviewing. You are intentionally and selectively working. And I'm going to go back to Marcus because Marcus is the one who offered this. You're eliciting, you're evoking from that person. And then once you evoke, you are then putting what you got to work. Okay? And you're using their motivations. So you don't have to motivate them. You're using their motivations. Now, I see that a couple of other people put something in the chat, so I just want to take a moment to read it. So, Yep. So Juliet says, I think it's about how I can get on their level to meet them where they are. And that's back to that collaborative partnership. Allison writes, empathy and collaborative conversation. These are the first things people think of when they think of motivational interviewing. Trying to get the client to talk openly. I'm always trying to figure out if I'm doing it right. Yes, Darlene, you're not alone in that. Some people are trying to figure out if they're doing it right, and some people are trying to figure out if they're doing it. And the thing I want you to be very clear about, folks, is it's very clear to tell if somebody is doing it or not doing it. And right is a little tricky because there's not any one right way. And again, as we move forward, we're going to talk a lot more about that. Charles writes, it allows them to share where they are at and where they want to go. Absolutely. Allison writes, roll with resistance, support self-efficacy, express empathy, develop discrepancy. I'm textbook. You are, Allison, and the textbook that you're reading from is the, I believe, 2nd edition, because roll with resistance actually is not in the 3rd edition and is not in the 4th edition. And that doesn't make it wrong. And it's funny, I'll tell you a brief story about that. Bill Miller was in Chicago just recently, and I had the opportunity to be there at the Mint Forum. And he was talking about roll with resistance because that's in the 2nd edition of their book. And that was one of the 5 principles of motivational interviewing. Meaning that if the person's resistant, you just kind of roll with it and you don't, and you help develop discrepancy. Well, he talked about when he wrote the 3rd edition, and now he and Steve Rolnick are working on the 4th edition, how hard it was for him to let go of that phrase of rolling with resistance. And the reason they let go of it is because rolling with resistance is labeling the person as they are resistant and as if that's a bad thing. And it's actually not. It's just where they are in their process of change. Jaime, you agree with that, right? I can see by your face. So they let it go. And Bill Miller said at this conference, he said, it was so hard for me to let that go because it was so catchy and people loved it. And it was also roll with resistance sounds a little bit like Rolnick, Stephen Rolnick. So it was his tribute to Stephen Rolnick. But he said they let it go because it implied that the client was being resistant and that was bad. We have to just roll with it because it's bad. And he said that's not the essence of it. So that phrase is not in the 3rd edition, nor will it be in the 4th edition. So just keeping that in mind that, things evolve. And that's the beauty of motivational interviewing. It's evolved over the time that it's been around. And it's probably one of the most studied evidence-based practices around. And I would say probably equal to or maybe even surpassing CBT, cognitive behavioral therapy, which is also very highly studied. So before we go to the next slide, Allison writes, I'm glad to hear that. I was thinking how the term resistance has a negative connotation. Absolutely. Absolutely. And I'll tell you, just related to what Allison just wrote, the first title of their book was Motivational Interviewing, Preparing People to Change. That was the title of the 1st edition of their book. Okay, come over here. I'm going to prepare you. Okay, scary. So they've backed away from that. The 4th, yeah, Marcus likes that. Like, okay, I'm not going to prepare you anymore. At least it didn't say I'm going to process you for change. That would have been even worse. So because work has been done, research has come in, the title of the 4th edition now, which is, you're hearing it here, although you may know about it already, is Motivational Interviewing, Helping People Change and Grow. And thank you, Paulette and Vanessa, because they're really emphasizing the centrality and the importance of that collaborative partnership. Remember, if Bill Miller could go back and do it over again, I'd call it motivational conversations. Okay? So one other thing to take away from our brief time together for today is that when you choose to use motivational interviewing because there's an identified behavioral change goal that the person feels ambivalent about, all you have to do is go in and prepare to have a conversation as a collaborative partner. You don't have to go in and adopt, well, thank you for coming to this session today. And you don't have to present yourself at you're there. It doesn't mean you don't have the training or the lived experience that you have. That's all valuable. That's all what you contribute to the partnership. But you're not there as the expert. The client is the expert of their experience. A couple of people have also added some other things in the chat. Jaime writes, working with ambiguity. Absolutely. Vanessa writes, identified need is key, as you said. Yes, and let's be very clear. Identified behavioral change goal. Okay, and let me give a concrete example before we go forward with the slides. I had a conversation with a young gentleman. I've shared this example before, but I think it's a good illustration. Had a conversation with a young gentleman who his behavioral change goal, what he was considering this behavioral change goal, was currently he was smoking weed on a daily basis, and he was considering cutting down how frequently he was smoking. Okay, so that was his behavioral change goal. And that may ring familiar with many of you. That's a harm reduction goal. Okay, and that's perfectly okay. Yes, absolutely, Tiffany. It's harm reduction. And that's perfectly okay in MI. A harm reduction goal is a viable behavioral change goal. So that's the change goal that this person was considering. Now, he was also ambivalent about it. There was a part of him that wanted to continue smoking on a daily basis, and there was a part of him that also wanted to cut down. So this is what he said to me. He said, well, you know, I'm considering cutting down, but I really only smoke weed as a way to feel comfortable in my own skin. And it's also how I hang out with my buddies. We meet for lunch, we smoke a little bit, and then I go back to work. And it's part of the way I socialize. Although my boss has told me that if I'm late back from lunch one more time, he's going to fire me. And my girlfriend has mentioned on more than one occasion that when I'm stoned, she says I treat her disrespectfully. So that's what the young gentleman tells me. Okay? Now I want to ask you a couple of questions. First of all, question number one is, what's the identified behavioral change goal? What's the identified behavioral change goal? And you can either write it in the chat or you're more than welcome to unmute. Let's see who's, and Tiffany wrote earlier that it's a harm reduction goal. That's very true. But what is this young gentleman considering? And you can unmute. What's the
I think it's what he verbalized, like he wants to reduce the weed. That's what he verbalized.
Thank you. That's, you got it, Gloria. He wants to reduce the amount of weed he's smoking. Okay. He hasn't said how much. People are typing in cut down, reduce smoking. Yep. Yep. Absolutely. Reducing his marijuana use. Perfect. And it's what the young gentleman said. Now, Gloria, since you're still unmuted, could I, and I mean, unfortunately, it's a hazard of remaining unmuted, but would you be willing to allow me to ask you a quick follow-up question?
Sure.
Okay. So based on what the young gentleman just told me, which I shared with you, would it be fair to say he's ambivalent?
Yes.
And what leads you to that conclusion?
Because he's thinking about it. He says he wants to, but he's not committed to the change.
Yep. Yes. He wants to, he's thinking about it, he's considering the change. Somebody just wrote, and I want to identify who, because I really like learning your names. Lena writes, he sees pros and cons, and he shared pros and cons. Alyssa, he states the desire for continuing and harms of continuing. Yes, pros and cons. Bruce writes, he smokes with his friends, enjoys the socializing part of it. Absolutely. Two sides of the coin. Thank you, Sylvia. Thank you. Yeah, so it's two sides of that coin. That's the ambivalence. Okay? Now, if there is one thing, and if there's only one thing, and I hope there'll be more than one, but if there's only one thing you walk away with from part one of this learning community conversation, it's that when somebody is ambivalent about a behavioral change goal, that is an opportunity for us to practice motivational interviewing. So much, I want you to remember that so much, I'm going to ask everybody to type the word opportunity in the chat right now. So when that, thank you so much, Christine, you're a leader. So when that person expresses their ambivalence to us about this particular behavioral change goal, that is an opportunity to us. Ambivalence is an opportunity. Okay? All right. Now we know, based on what this young gentleman just told us, and a couple of people, put this in the chat, we know, and also because of our conversation with Marcus, we know that we're not going to try and motivate this person, right, Marcus? We're not going to try and motivate them. Okay. So my question to you is, the young gentleman has just said what he said. What are we going to say next to him? And keep in mind, we see an opportunity, and we are going to practice motivational interviewing. So what are we going to say to him next? He said that as part of the collaborative conversation, and now it's our turn to say something because we're in a conversation. Okay? Okay, so people are describing what they would do in the chat, which is great. But what I'm going to ask is, would somebody be willing to unmute and say to me, the young gentleman smoking weed on a daily basis, and clearly I'm playing a scenario because I am not a young gentleman, but what would you say next? And we're in a learning community. We're practicing here. Yes.
What happens if you, you tell me you want to reduce and you feel like you said your girlfriend says you're not as nice to her, when you're smoking, but what would happen if you can kind of continue with this? Like, how does that going to play out, or like in a respectful way? Like, how do you see that happening if this kind of continues going on the way it has been going? And then, he can kind of elaborate and say from his perspective what he feels like what would happen, and then kind of building off from there.
Okay, Bruce, thank you so much for jumping in. And Kristen, don't lose your thought. But Bruce, I want to underline something that you said, okay? Because Bruce said a lot, and I want us to be very specific. So Bruce said, and Bruce, you tell me if I heard you correctly, okay?
Okay.
Bruce said he would say back to the gentleman, well, the goal you're considering is cutting down the amount you're smoking, and your girlfriend has told you that she feels like you don't treat her nice when you're stoned. And what do you think the outcome will be if you keep doing this? Bruce, did I basically get what you said?
I think so. That's good. Yes.
Okay, excellent. So let's talk specifically about the skill that Bruce brought to what he said. He reflected back the behavioral change goal. He restated it. He also restated back something specific that the client said that is about why he's considering making this change. And by the way, Bruce, you probably know this, but I just want to underline it. What you reflected back, in addition to the behavioral change goal, is you reflected back the client's change talk. Okay, you probably knew that, right? Did you know that?
I mean, I've been thinking those specific terms, but I think that's the general vibe what I was talking about. I'll write that down. Change talk, though.
That's it. Yep. So Bruce heard the change talk and he reflected that change talk back. And then he followed it with an open-ended question. And by the way, it was intentional and it was specific, because it was an open-ended question about, well, what are your thoughts about what the outcome will be if you continue this way? Okay. That is a very skillful way that one could proceed. So Bruce, thank you for starting us off, and thank you for really demonstrating the use of reflections too, followed by an open-ended question. Kristen, what were you going to say? And then we'll go to Alyssa.
Sure. I was going to say something similar. I was going to just reflect that what I'm hearing you say is that you're considering reducing your marijuana use because you are having this conflict with your girlfriend, and exploring that further with him.
Fantastic. So again, very similar along the lines of Bruce. Perfect. Alyssa, what were you going to say?
I was thinking I would pull a little bit at his heartstrings and just see, how do you feel after hearing that your girlfriend says that you're a different person? Do you notice it? And also, your boss is talking to you about possibility of losing your job. How do you feel about that? Do you think that is a possibility?
Okay. So again, I want to affirm a strength that both Bruce, Kristen, and Alyssa have brought to what they might say next. All three of them identified the change talk. All three of them reflected the change talk back. Folks, I wasn't going to say this until part 2, but thank you, Bruce. Thank you, Kristen. Thank you, Alyssa. We can say it here because they've demonstrated it so beautifully and so skillfully. Is they just demonstrated employing the change talk. I cannot tell you, folks, how many audio recordings I've listened to where the person is practicing motivational interviewing. And again, they're practicing, right? They're practicing motivational interviewing. The client has offered change talk, and they simply leave that change talk unemployed, ignored, going down the drain in the background, and then go forward with another question. But Bruce, Kristen, and Alyssa, all three of them intentionally employed the change talk. That is how you strengthen and build motivation. Consider this. The young gentleman said it once. Bruce, Kristen, and Alyssa reflected it back. The client hears it again. Possibly at the conclusion of the conversation, Bruce, Kristen, or Alyssa might repeat it and include it in a summary. The person hears it a third time. That's how motivational interviewing works, folks. It's employing the change talk that you've, and I'm thinking of Marcus as I say this, that you've elicited or evoked from the person, because it's their motivation. I don't need to add anything. All I need to do is employ what they offered. Okay? Now I'll tell you, and again, we've had such skilled and clear demonstrations. I don't know if anybody was thinking about this, but I wonder if anybody was thinking about asking questions about, and it may be in the chat and I haven't seen it, but I'm wondering if anybody was thinking about asking questions of like, well, what do you think you do to reduce the amount of marijuana you smoke? And it would be normal that you might think that. But what I want to go back to is the strength of what Bruce, Kristen, and Alyssa did is they employed the change talk. They didn't rush to planning. And the benefit of that is that you're strengthening the person's motivation. So when they are actually ready to plan, they've got a lot of energy behind making that plan. It could be very tempting to be like, oh, okay, so what do you think you'll do to cut down the amount of marijuana you're smoking? Paulette is smiling. She understands that pressure, I think, if I'm reading your expression correctly, Paulette. So what Bruce, Alyssa, and Kristen did is they employed the change talk. They didn't jump the gun, Jacqueline. You're absolutely right. They didn't jump the gun. Yeah, go ahead, Marcus. What were you going to say?
Yeah, I was going to say, what if you say, what do you think you should do in this situation? Is that okay?
Well, that would still be going to planning.
Oh, okay, it is. Okay.
It is.
It
is. And I'm glad you asked, Marcus, because a lot of people think that that's actually the next step. And what MI is inviting us to do is to employ that change talk and then see what happens. So Marcus, if you don't mind, would you, since you're unmuted, and again, it's a hazard of remaining unmuted, but would you be willing for, Gloria understands this very well. She's she feels for you. So I'm wondering if you would be willing for a moment to be the young gentleman who's smoking weed on a daily basis.
Oh, okay.
Would that be okay?
Yeah.
And I'm going to be the counselor for a minute. Okay?
Okay.
Okay. So I am going to, without apology, steal everything that Bruce, Alyssa, and Kristen did. And now I am going to speak to the client. And I just want you to observe what I'm doing. Okay? So hopefully Bruce, Kristen, and Alyssa they'll either give me a thumbs up, a so-so, or a thumbs down if they think I botched it. They'll judge my theft of their skill. Okay? All right, so pay attention. So Marcus, just for the purposes of this little momentary practice, I'll just use your name, Marcus, okay?
Okay.
Marcus, thank you so much for talking to me about this change that you're considering, which is cutting down the amount of weed that you're smoking on a daily basis. I'm wondering if it would be all right if I summarized a little bit of what you said.
Okay, there we go.
Okay, so you're considering making this change of cutting down the amount of weed that you're smoking because you don't want to lose your job. And your girlfriend has told you that she feels disrespected sometimes when you're stoned, and your relationship with her is important.
Right.
Yeah. Did I get that right?
Yeah, you did. Because I'm worried about losing that relationship, and we've been together for a long time, and I don't want that to happen. So yeah.
Right. Yeah, you don't want to lose something that you've had for a long time.
Yeah. Right.
Are there any other thoughts or any other reasons that you have for considering this change at this particular time?
It's just, I guess I'm more worried about the withdrawals. Like if I do cut back some, it's just, that's my main worries. And yeah.
Yeah.
Just
Yeah. So you're going to make sure that when you do cut down, you're going to do it in a way that's not going to cause a problem with your health. You're not
Yeah.
going to have kind of withdrawal symptoms. And you're considering doing this really because you want to stay employed and you don't want to throw away a long time relationship.
Yeah, definitely.
So let's pause right there. Okay. So Bruce, Kristen, Alyssa, any thoughts, any reactions?
I think it was good. I think you started off paraphrasing kind of what he said, and then you let him respond, and you just didn't monologue it. And then he was able to respond, and then you reflected that and kind of expounded upon that. So I think it was a good job.
Okay. Thank you.
I wrote it down, but I just said I like the idea of how you asked, are there any other concerns? To have them kind of share if they had more thoughts, then they feel vulnerable and they feel comfortable to be vulnerable and share other concerns if there are more. So then you're kind of going down the rabbit hole of like, let's attack every thought you have that's concerning this motivation.
Okay.
Yeah.
And by the way, I did that in honor of Marcus because Marcus is the one who put elicit on the table. So
Yeah.
I wanted to elicit more change talk if there was more change talk available. Kristen, any thoughts, any reaction?
I like that you continue to reflect back to him throughout the conversation. That way he has an opportunity to make any corrections if you didn't understand something the way that he intended it.
Yeah, I like that.
Okay, yeah, Marcus, as the client, any thoughts, any reactions to our brief interaction?
Yeah, I felt comfortable talking to you because you laid you gave me opportunity to, like you said, to correct if you got the story wrong or if there was something missing or if I need to add something that was bothering me. That I think that was very important to leave that space there. Again, you're that collaborative partnership. You're not going to move one step ahead of the client if you get to meet them where they are. So I really like that.
Okay. Could I ask you just one brief, specific follow-up question?
Yeah.
Did I motivate you?
Yeah, I think so. Because I think you motivated me because, like, again, when I talked about the withdrawals and concerns that might of my health, it made me like, it made me think a different perspective on my issue of my reducing the amount of smoking. So maybe I do need to consider my health in this situation, and that was really good.
Okay, but you brought up the health issue, right? You brought up the withdrawal.
I did, yeah.
So that was your motivation, not really mine.
That's true. Yeah, you're right. Yeah.
Okay, go ahead, Vanessa. Vanessa wants to get in on this comment. She wants to say something.
Yeah, I just really like the fact that you kept it about him.
Yeah.
Instead of saying, well, what about the consequences? You didn't talk about consequences. You talked about how he was considering it, about what he felt, and how he could. And can I summarize for you?
I asked permission. Yeah.
Yes. It was, very personalized. And you didn't pull in all the other things of the world. You spoke about what he said, not because of what he had said earlier. Oh, I'm overwhelmed with all these problems and my friends and my girlfriend, my work. He had a lot, but you focused on the more like, who's it? Alyssa talked about the heart jerk too. And also to consider, like he even started to talk about considering his health and but the ambivalence of withdrawals, like nobody really wants to talk about that. No one wants to say these days, especially, I'm addicted to this thing.
Right.
Yeah.
Right.
But he did.
But he did.
Brought it up.
Correct.
Yeah.
Correct.
So,
I did.
so
Exactly.
that was the change. Yeah.
Exactly.
Yeah. That's what you said. Yeah.
Yeah.
So you were able to elicit that.
Yeah.
And he opened up.
Yeah. Go ahead, Bruce. Yeah.
I just wanted to add on. I think I appreciate those observations, but I saw in the comments too, Allison said your overall demeanor was motivating to me. And I think that's a really big part too, like your body language and just being open and receptive and like you know, when you're nodding your head and the eye contact, is it too much? Is it too little? And I mean, I go down a rabbit hole in those things, but I think the inflection in your voice and the way you respond, you know, to the client is really important too. Like if you're kind of monotone and you're, you know, you could say all the right things, but if you're not, you know, engaged like the way you have been doing there, and I appreciate that. I think that's a really useful skill in MI.
It is. And, you know, Bruce, thank you for pointing that out, because again, when you do that, it builds partnership. I'm present with you in this conversation. I want to try and understand it from your perspective. And that builds partnership. That builds partnership. Thank you. Thanks. Go ahead, Clive. I see your hands raised.
I want to say active listening plays a big part in the whole scenario.
Sure.
You know, yeah, the counselor has to make sure that the client is engaged and is open to the discussion. The client has to, you know, want to, you know, to give up the information. We all know that, you know, hearing and listening are, you know, two sides of the same coin. You can hear, we all hear, well, you know, unless there's an issue that we can hear, but listening is just that's a whole nother, you know, attribute to the scenario, to the growth process.
Absolutely. Absolutely. And, you know, Clive, I appreciate you noting that, because what I always like to say, and I'm pointing at my bicep here, that listening is muscular. And in MI, we learn how to listen to understand, not to speak. We listen to understand from that person's perspective, because the deeper our understanding is, the more we're actually able to create a collaborative partnership. So, you know, we can all always be assessing where we are in terms of our ability to listen, to be actively listening. But what I want to assure you is that that's muscular. The more you practice it, the better and the stronger you get at it. And keep in mind, folks, and this is essential to motivational interviewing, and this is something that Marcus, I thought, demonstrated kind of beautifully as the client, and I heard this when he said it, that we can listen to the content, what's on the surface, but there's all kinds of communication under the content. And when we're practicing motivational interviewing, we're listening to everything. Okay, we're listening to the words the person's saying, but we're also listening to how they're saying them, and we're listening to what they're communicating. And what Marcus, I thought, demonstrated so beautifully is the client was he demonstrated by the way he said what he said, that he'd made an investment in this relationship, that this is something that had been going on for a while, and he didn't want to lose it. And if I'm reflecting back to him, and I think I did this, I think I said to him, you know, you don't want to throw away a long-term relationship because it has meaning to him. So I want you to understand that there's listening on top, but there's also listening to the full depth or the full richness of the communication that the person's offering. And in MI, we have the opportunity to reflect all of it. And I'm going to tell you something. I'm strategic when I practice motivational interviewing. I'm going to reflect back. I'm going to employ what's most important or what's most meaningful to this person. I'm going to leave out the other stuff. And I'm going to focus on what's most important to this person, what's motivating them the most. And I think it was Alyssa who said this, but what's going to pull at their heartstrings the most, because that's what's motivating them. It's not the other stuff. That's what I'm going to employ. That's the change talk that I'm going to intentionally employ. Okay? So keep that in mind for a minute. I'm going to share my screen. We're going to cover a couple of details. And then I have a very brief video that I'd like to share with you. Okay, so we're going to look at a couple of details, have a little bit of a conversation about these. Some of this we've touched on already, but I also want you to have the slides for this so that you can use them and use them to refer to as you see fit going forward. So we've talked about ambivalence. Please do not read the definition that's on this particular slide. I know you may have been tempted to. I know you may be resisting the impulse to want to read everything that's there. Don't do it. And the reason I'm asking you not to do it, one, you know that ambivalence around a particular behavioral change, and don't read that slide if you can avoid it, but you know, based on our conversation thus far and the little bit of practice that we've done, that ambivalence, I want to, I don't want to, about a particular behavioral change goal is an opportunity. So much so that you type that word into the chat, that it is an opportunity. It is an opportunity in terms of practicing motivational interviewing. Now, what I'm going to ask everybody to do, I'm going to ask you a personal question. And the personal question that I'm going to ask you, and you can do this by show of hands, or you can type a Y in the chat. Yes, you're right, Jaime. Ambivalence is an opportunity. If you've ever in your life ever felt ambivalent about something, raise your hand. If you've ever felt ambivalent about something, at least once in your life, raise your hand. Okay? Okay. And you can put your hand down now. You're going to need the energy. But what I just want to acknowledge is I see a lot of raised hands, that just about everybody, or thumbs up. Thank you. So, and I love now in Zoom that the thumb kind of does this. It's kind of an active thumb. Okay, I've asked that question before, and I've seen people immediately put both hands up because they've experienced, they could be experiencing ambivalence right at this very moment. So if you've ever experienced ambivalence, okay? Now, I think it's significant to note how many people raise their hands, okay? So just hold that visual. In your mind. Okay, I'm going to share my screen again. And again, hopefully you have not read this definition. So consider this, based on at least what's in our learning community, ambivalence is common. It's also normal, folks. It's not a bad thing. It's just a normal part of the feelingscape, i.e. the landscape, but the feelingscape that we may have. It's also part of the human experience that we may feel ambivalent about things, and may especially feel ambivalent about change. And I see a lot of Y's typed in the chat too. And thank you for that participation. So it is also part of the change process. And I'd like you to consider, like the young gentleman that was so well portrayed, that when someone's considering making a change, that oftentimes there is ambivalence about it. I want to for these reasons. I don't want to for these reasons. I feel I can do it, but I also am concerned that maybe I can't do it. That's that back and forth, that's seesaw kind of. And I think the other thing to really, really keep in mind, that ambivalence is not resistance. It's not resistance. Because that young gentleman also told us why he smoked weed on a daily basis. And I'm wondering if anybody remembers what he said. But because that young gentleman also shared that with us, which is great because we have a deeper understanding, it doesn't mean that he's being resistant. Yes, Alyssa writes to be with his friends. That was one of the reasons. And there was another reason he mentioned too. I wonder if anybody else caught the other reason. So I'm going to stop sharing my screen for a moment and ask, Alyssa's absolutely right. It was to socialize with his friends. Does anybody recall the other reason? To relax, relaxing, yes, makes him feel comfortable in his own skin. That's a quote. Really beautifully remembered. And Lena writes social anxiety. Possibly, yeah, harm reduction. And that's the change goal. Okay, so Sylvia mentioned this earlier, that we can think of ambivalence as a coin that has two sides. One side of that coin, that language of ambivalence, is it's how I hang out with my buddies. It's the way I socialize. It's how I feel comfortable in my own skin. That's one side of the ambivalence coin. Flip the coin over, and we have the other side, which the other side is, I don't want to lose my job, and I also don't want to lose a long-term relationship. That's the other side of the ambivalence coin. Both sides are normal and human, and they're both part of the language of ambivalence. What you saw Bruce, Kristen, and Alyssa do, and do so skillfully, was they employed the change talk, this side of the coin. They heard the other side of the coin, that's called sustain talk. They heard that, but they didn't employ it. They didn't reflect it. They didn't summarize it. They didn't say, tell me more about smoking weed with your friends. They didn't ask an open-ended question about it. Because if they do that, if they were to have employed the sustain talk, guess what you're going to get? Guess what you're going to get? Anybody? Go ahead, Kristen.
All the reasons why they want to continue it and less talk about change.
You're going to get more sustain talk. Yes. And I love the way Kristen put it. You're going to get more reasons why they want to keep doing it. Guess what? That's not going to guide them toward their change. But if you employ the change talk, like Bruce and Kristen and Alyssa did, you're going to get more change talk. And you're going to build motivation for the change. That's the intentionality and the selectivity behind the practice of motivational interviewing. I don't know about you, but when I went to school, when I was trained to be a counselor, I was trained to summarize everything. And in MI, we don't do that. We pay attention to everything. We're present for everything. And we employ the change talk around the particular change. Because that is what is going to guide the person toward the change. We're not motivating them. We're using their motivations to help them to move toward the change. Okay? All right, I'm going to share my screen again. So again, I'll just underline the one thing that I really want you to walk away with, if there's anything you walk away with today, and I hope there will be, is that ambivalence around a particular behavior change is an opportunity to practice motivational interviewing. And when you think about that, think about Bruce, think about Kristen, think about Alyssa, because they practiced motivational interviewing. They employed the change talk. They strengthened motivation and helped reduce ambivalence around the particular change. And the change that Marcus, the client, was considering was cutting down the amount of marijuana they were smoking. Okay? MI is very simple to understand, and it requires practice to do it. Because you do it with intention. So just keep that in mind. I'll share my screen again. All right. What I'd like to share with you at this particular point is a definition that supports what we talked about earlier, which was just asking an open-ended question does not mean you're practicing motivational interviewing. P.S. Bill Miller and Stephen Rolnick did not invent the open-ended question, the affirmation, the reflection, or the summary. What they did do is they came up with a snappy way to remember them, OARS, O-A-R-S, an acronym, a very snappy way to remember them, which unfortunately leads people to think, because they're using them, that they are actually practicing motivational interviewing. Well, they may not be, but I'm going to stop sharing my screen for just a moment. I want to underline that Bruce, Kristen, and Alyssa were practicing motivational interviewing because they were using an intentional reflection to employ the change talk. Bruce used an intentional and skillful open-ended question to evoke more change talk about the specific behavioral change. Okay, so that is what makes the difference. I've listened to many audio recordings where people are asking all kinds of open-ended questions, and they don't have anything to do with an identified behavioral change. So they're not practicing motivational interviewing. They're using an open-ended question. Great, that's great. Use open-ended questions when it's appropriate to do so. But if you're practicing motivational interviewing, do what Bruce did, or what Alyssa and Kristen suggested in open-ended questions that they might ask that relate to the behavioral change goal, because you're evoking more change talk to build the motivation for that behavioral change goal. Okay? Gloria, any thoughts, any reactions to that?
I've just learned that what I thought I knew, I didn't know. It's almost like the saying, what I know is I know nothing. So I'm getting a lot of information.
Thank you. Thank you. All right. So again, just keeping that in mind, folks. I'm going to share my screen again, and let's walk through this definition. First and foremost, we know that it's a client-centered conversation, and it's between two, and I think you can see me, but I can't see you. And I'm holding my fingers up, so hopefully you can see them. But it's a client-centered conversation between two collaborating partners. And what makes it an MI conversation, when we can actually practice MI, is that that conversation between the two collaborating partners is focused on a specific behavioral change that the client feels ambivalent about. And I'm going to pause sharing my screen for just a minute. I want to underline something. If you're talking to a client about a particular behavioral change that they don't feel ambivalent about, that they're already saying to you, you know, Thomas, I just want to let you know, I'm going to do this, this, and this, and I'm going to make this change. Guess what, folks? You don't need to practice motivational interviewing, because that person is not ambivalent. They're ready to plan. They know what they want to do to make that particular change. And they are going to tell you what their plan is and do it. Doesn't mean there may not be bumps along the road, but they're not ambivalent about it. Am I is for the behavior change that part of the person wants to make the change and another part of them doesn't. So that's why MI is not for every conversation. There may not be an identified behavioral change goal, no opportunity to practice motivational interviewing. There may be a behavioral change goal, but the person's not ambivalent. They're ready to do it. No need to practice motivational interviewing. Okay? The MI practice is for a behavioral change goal that the person feels ambivalent about. They want to and they don't want to. Okay? Going back to my screen a moment. And don't hesitate to interject, question, or comment at any point during anything that is going on during our time together. So, when that identified behavioral change goal is identified that the person feels ambivalent, Marcus writes, I think sometimes we work too hard when doing therapy. Yes, agreed, Marcus, agreed. And again, depending on what our goal is in the therapy, again, our goal in the MI conversation is to explore the ambivalence about the particular behavior change and to identify the motivations. So we are intentionally guiding the conversation as the worker. We're intentionally guiding the conversation to explore the ambivalence about that behavioral change. Remember the two sides of the coin. And to identify and increase that person's motivation or motivations. Marcus, the client, had several motivations. Wanted to make sure that was going to cut down in a way that was going to be good for his health, so he wouldn't have withdrawal problems. Wanted to make sure that he stayed employed. Didn't want to lose a long-term relationship. That's 3 motivations that Marcus, the client, had in regard to the change goal that he was considering, cutting down the amount of weed he was smoking. So we're guiding the conversation to explore that ambivalence and to increase and identify the motivations. And once those motivations are identified, we want to employ them. And you saw excellent examples within our learning community of those motivations being employed. Okay? So there has to be a behavioral change goal that the person feels ambivalent about in order to practice motivational interviewing. Now, there are 3 primary parts of the practice of motivational interviewing. We've already talked about number 3. Those are the core communication skills. Those are the tools we use when we're engaging in the conversation we're engaging in. We saw our colleagues effectively do intentional reflections and intentional open-ended questions related very skillfully to the behavioral change goal. MI spirit is really guidance that lays out how we interact as that collaborative partner. And the 4 tasks, excuse me, the 4 tasks are simply the work that we do when we're engaging in the MI conversation. And we've already talked about the first one in great detail, thanks to our colleagues in the learning community, building the collaborative partnership. In MI, that task is called engagement. Okay? We're going to go over these in great detail, probably next time, not this time. I'm going to stop sharing my screen for a moment. And I want to set up a little video that I'm going to show you. I just want you to watch this video. I'm very curious as to what your reactions to it will be. I'll ask you some specific questions, But what I'm going to invite you to do as you watch this video is just let whatever stands out to you stand out to you. There's no right or wrong. It's just whatever may stand out to you about the conversation or the interaction. I'm going to put it that way, the interaction that you're observing. Now I'm going to give a spoiler alert, and really it's not really a spoiler alert so much as I want to prepare you for what you're about to view, because I have no idea what anybody's relationship is to the profession of dentistry or to dentists. But this is a conversation between a dentist and a patient. And I just want to throw that out to you, depending on whatever your feelings, thoughts, or reactions are to dentistry or dentists. But I just want you to be aware of that. Okay? So that's what you're going to be watching, is an interaction between a dentist and a patient. Now, you may be saying, why is Paul showing us a video of a conversation between a dentist and a patient? Well, I want you to consider that any helping professional, regardless of their profession, anyone who's engaging with somebody who may have a behavioral change goal can practice motivational interviewing. Okay? Because it's a conversation between two collaborative partners about a particular behavioral change goal. I'll also add, and trust me, I am going to show you this video, but I'll also add that one does not need a degree or advanced training to practice motivational interviewing. And I'm going to let you in on a little, how can I put this? I'm going to let you in on something that I've experienced over the many years that I've been training motivational interviewing. Oftentimes, people who have no training as a therapist or a counselor or a clinician are oftentimes, especially at the beginning, much better at motivational interviewing than people who have lots of training, including myself, because I'm a trained social worker. And I had to work really hard to learn motivational interviewing, because I had to unlearn things that I had learned related to my prior training. And don't misunderstand me. I'm not saying you throw those things out. What I'm saying is you can play the piano as well as the trumpet. Because when you want to practice motivational interviewing, you want to be able to do that in a way that's going to be effective. And I'll give you a concrete example. I was trained to summarize everything. I had to learn how to summarize selectively and intentionally to build motivation. I had to learn that skill. So watch this video, let it roll over you as it does, and then we'll check in with each other after. It's brief. We'll check in with each other after. And again, I'm just interested in your honest thoughts and reactions to the video. Okay? All right, here we go. Zoom, please work for us. All right. Here we go.
So finish the exam. Have some good news and they have some not so good news. Looks like you don't have any cavities, so that's the good news.
That's great.
However, I'm pretty concerned about something I'm noticing in your mouth. Actually, if you look up here, the roof of your mouth, I'm noticing a lot of irritation that's really consistent with tobacco use. And you had said on your form that you're not a tobacco user, so I'm just wondering what's going on.
I don't smoke cigarettes.
Okay. Well, as I said, there's a lot of irritation. In particular, like I was mentioning, up here in the roof of your mouth, it's turned really deathly white colored, and there's little red spots. And you probably didn't notice because we don't spend a lot of time looking at the roof of our mouth. But you're really damaging this tissue in your mouth, which can really cause some severe problems in terms of your oral health. It's called nicotinic stomatitis, and this is something we don't see in any patients who don't use tobacco. So maybe you're not smoking cigarettes. Are you smoking a pipe or cigars, or is there something else that could be contributing to this? Because I don't know what else might be causing it.
Well, the only thing, I've never smoked cigarettes ever. But when I go out with my friends, we like to go to, we like to go out to lounges and sometimes there are those nice young men that gift you different sorts of things. And we got some of those mini cigars, Swisher Sweets. They come in peach and grape. And that's the only time that really, I've ever really used anything that's got tobacco in it.
Okay. So I think that's a pretty common misconception because they're fruit flavored. People think they're okay. Those are really bad for you. Did you know that?
Really bad, but they're just cute little girly cigars.
Right. They're still cigars and they're still tobacco. And so they still cause lung cancer, oral cancer, emphysema, all those same kinds of things that you would see with cigarettes.
Well, I only use them just to relax. I mean, it's not like it's something that I would smoke 20 or 30 cigarettes a day. I mean, I only do it when we go out.
Well, at least you're not doing that. So that's good. But it's still causing a lot of problems. And as I said, I can see the evidence in the roof of your mouth. You're causing some serious damage and this needs to stop. Have you thought about quitting?
Well, I didn't really know I'd started.
What do you mean?
I didn't really think that it was anything more than just like social drinking. Just something that I do in a social setting when me and my friends go out to the bars.
So you're going to quit then?
Maybe.
What do you mean maybe? I just told you how bad it is for you. It's messing up your mouth. You're putting yourself at risk for all these other diseases. This is really important. You need to quit.
Well, it's something that I'll have to think about.
What's there to think about? You said it's not something you do all that often. There's all these negative side effects. There's all these risks that you're putting yourself in.
Well, it's just something that I do to relax, and I don't do it that often. And so I probably could cut back.
Okay, well, that's a good start, but cutting back isn't going to do it. If you actually quit the smoking, you can reverse all the damage you've done in your mouth, and you can stop yourself from being at risk for these other diseases. But as long as you're continuing to use these cigars, you're really putting yourself in a lot of danger.
Well, I don't believe that they're cigars. And what I do believe is that it's a choice and it's my right. And it's something that I choose to do. And so I will think about cutting back, but I'm not at a point where I'm ready to do that. And I'm not really sure that I even believe that what you're telling me is real.
You're choosing to really damage your mouth, and actually it can cause problems with your teeth too. I don't know if you noticed your teeth might be getting yellower than they were before. That's another side effect. There are a lot of really negative things that go along with any tobacco use, whether it's cigarettes, cigars, dip, chew, snuff, snooze, hookah, any of it. This is a really important decision that you're making, and you said it's your choice, but you're really choosing to make yourself sick and potentially die.
Well, it's something that I'll think about.
Well, I appreciate you thinking about it. I hope you'll think about it really hard. You know, this is something that I'm going to continue to ask you about because it's something that really needs to change.
Okay, thanks for watching that. Yeah, exactly. Look at the look on Gloria's face. She's like, ah. All right. Now, this is what I'm going to ask everybody to do. And you're doing this on your own. Okay, but I'm asking everybody to do this. Please reflect, and you're more than welcome. And I see that people have put things in the chat. Fantastic. But what I'm going to ask everybody to do individually, because we're going to go into a brief small group activity, what I'm going to ask everybody to be prepared for that activity to do this. I want you to jot down either mentally or on a slip of paper or whatever, without judgment. You don't have to have any judgment about this. What I'm going to ask you to do is just jot down the 3 things that stand out to you most about the way the dentist interacted with the patient. And as soon as you've jotted down either mentally or on paper, those 3 things that stand out to you most about the way the dentist interacted with the patient, just type a Y in the chat. And then I'll know it's time for you to go to the small groups. So as soon as you, thank you, Nathan. Thanks, Autumn. Thank you, Judy. So Allison, excellent. So as soon as you've jotted those 3 things down, there's no right or wrong. It's just the 3 things that stand out to you about how the dentist interacted with the patient. As soon as you've jotted those things down, type a Y in the chat, and then I'll know that it's time for us to go into the small groups. Okay? So I'll give you just a moment to finish that. And as soon as you've got your 3 things, just let me know by typing a Y in the chat. The letter Y, not the word Y, W-H-Y. You may be asking why I'm asking you to write this down, but we'll get to that. So the 3 things that stand out to you about this, and try just to let the first top 3 things that pop into your head come in. Okay, don't try not to judge it, just let it be whatever it is. Okay, yeah. Try not to give it too much thought. Okay. Yep. Okay. And remember, if you don't have a mic or whatever, when you go into your small groups, try not to worry. Just make sure you participate in the chat in your small group. Okay. So let me lay out what I'm going to ask for you to do in the small groups. It's very simple. I'm going to ask you in your small group to provide an opportunity for everybody to go around and just quickly share their 3 things. These are the 3 things that stood out to me. These are the 3 things that stood out to me. These are the 3 things that stood out to me. Just so that everybody gets to put theirs on the table. Okay? After everybody has put that on the table, I'm going to ask you as a group, and this will be the work that I'll ask you to do, out of everything that's been put on the table, and chances are there's going to be overlap, and chances are there's going to be things that are very different, and that's great. But of all the 3 things, of all the things that were discussed, I want you as a group to pick one that you see as the greatest barrier, and I'm thinking of Paulette, and I'm thinking of Vanessa when I say this. I want you to identify for your group which is the one that you as a group believe is the biggest barrier to collaborative partnership in this conversation that you observed. If you believe there was a barrier to collaborative partnership. I don't want to assume that. Maybe you thought it was fine. Paulette's like, maybe you didn't. I don't know. But what as your group identifies as the biggest barrier to collaborative I like that laughing, crying face, Alyssa. What you think is the biggest barrier to collaborative partnership. So somebody in your group, let's say Bruce is in your group, and let's say Bruce identifies to be the spokesperson. When you come back, Bruce will say, for group 2, we identified that X was the biggest barrier to collaborative partnership. Okay? So that's what I'm asking you to do in the small groups. Everybody goes around, you have a discussion, you determine this is the biggest barrier to collaborative partnership. Now, what I'm going to ask everybody to weigh in on at this particular moment using the chat, I'm going to ask everybody to weigh in on this, and then I will make a determination based on the weighing in. How many minutes do you think your small group needs to accomplish that task? And just type the number of minutes you think your small group needs to accomplish that task. So I have 5, 5, 3 to 5, 5, 7, 5, 8, 7, and let's try and get it 3. And remember, it's not going to be a small group of 3 people. It's going to be a small group of maybe 6 or whatever. 5 minutes, 10. Okay. All right, 10. Maybe I should have said that. It's not going to be a small group with just 3 people. Okay. Because again, you have to come to consensus as a group as to what the one thing your group is going to identify as the biggest barrier to collaborative partnership. Okay? Okay. All right. I'm going to go, just to err on the side of making sure that everybody has enough time. I'm going to be very generous. I'm going to go with 11 minutes. So Rose says 10 to 15. Rose, I'm going with 11. Because some people started with 3 minutes. So I'm going to go with 11. So I'll be watching the timer, and I will give you a warning when you have 5 minutes left, and I will give you a warning when you have 2 minutes left. But keep in mind, everybody goes around and shares their 3 things, and then you decide as a small group, whoever your spokesperson is going to be. Every group needs to have a spokesperson. Please ask for a volunteer, not a voluntold. I don't want it to come back and Autumn says, well, I was elected. I was the lucky winner. I didn't put my finger on my nose first. Okay? I learned that from people that was the way to opt out. So who volunteer to speak for your small group. There'll be 4 small groups. Okay? Does anybody have any questions about the task? Okay. I'm going to ask Zoom, please do it. Please put people into the 4 small groups, and you will have 11 minutes with a 5-minute warning and a warning at 2 minutes. Okay? And a volunteer spokesperson. I can't wait to meet the volunteers who will be speaking for your groups. I like the smile on Bruce's face. He's like, knowingly, yes. All right. You know what? I'm sorry. We should do 5 because that's between 13 and 14 people in a group, and 11 minutes may not cut it. So we're going to do 5 small groups. So there'll be 5 volunteers. And I think it may be obvious to you that you can tell that I do very much enjoy this conversation about the theory and practice of motivational interviewing. So again, I want to thank you for everything you're bringing to the table to make this such a rich learning environment. Thank you for that. So here we go, 11 minutes, and accept the invitation to be in your small group. Welcome back. Welcome back. So I'm going to trust the process that 4 volunteers were found. I'm very curious to meet them. So whoever would like to start as the volunteer who's reporting for your group, please just share your name and tell us if you remember what group number you're in. Sometimes it's hard to remember that, not to worry if you don't know that. But so Laura, are you one of the volunteers?
I am one of the volunteers.
Great.
We were group number 2. And we came around and we all had the same statement to make. We all had 3, but we all had one that was in there for all of us, that the dentist was hearing her, but she was listening to her, but not hearing what she was saying.
Wow. So listening but not hearing is the biggest barrier to collaborative partnership.
Yeah, she just was going on. She had no empathy. She was talking to her, not at her, no solutions. So when the woman was speaking, she just wasn't hearing what the woman was saying. Like she was willing to cut down or she was willing to do something, but the dentist had never heard anything she said. She had her own agenda.
Wow. And I have to say, Laura, first let me say thank you to you and to your group. And I must say, you were an excellent volunteer. And I don't know if you were voluntold or if you volunteered, but you very sneakily put in several others in addition to the one that you identified. So I just want to underline your deft skill at that.
Thank you.
Yes. Perfect. It's a common occurrence with some volunteers. Excellent. Excellent. It's hard to pick. You're very welcome. It's hard to
we
pick.
did all agree on one because we all had a statement, and because I was writing it down, I was like, okay, we all agreed on one. Okay.
Super. Very well observed. And thank you for starting us off.
Thank you.
Yes. Which of the 4 remaining volunteers would like to unmute and speak for you? Yeah, go ahead, Jacqueline, please.
So we were in group number 4.
Okay.
And there was no ambivalence to whether or not she wanted to even stop smoking. So that was our main one. And then the dentist even tried to create a partnership.
Yeah, made very little effort to create, or no effort to create a partnership.
Right. So I don't even know if we were discussing whether motivational interviewing was even a intent. So, yeah.
Jacqueline and her group have raised a very interesting question. And Jacqueline, thank you for putting this on the table, because you've kind of preempted me, because I was going to put it on the table later. But since you put it on the table now, Jacqueline and her group have really raised the question of, was that even motivational interviewing? Yeah, and I see Trina's like, no, it was not. And Trina's right. It was not. That was not an MI conversation. In fact, when coding MI conversations, there are codes that you could use, and you would say that is an MI inconsistent conversation. Completely. So Jacqueline, thank you for putting that on the table, and for putting it on the table so soon, because I would hate for anybody to leave part 1 of this training and think, well, we saw this video of motivational interviewing and it looked pretty confrontational and there was very little partnership, because that wasn't motivational interviewing. So what I can tell you, though, it is possible for people who maybe adopt this expert approach to transition into practicing motivational interviewing. So I just want you to know that it is possible to change your approach so that you can actually be in a collaborative partnership. And you can actually practice motivational interviewing. Excellent. Thank you so much, Jacqueline, and thank you to your group. Another volunteer. Yeah, go ahead. Bruce, are you kidding me?
Hey, we had a lot of discussion. I was like, hey, I've already talked a lot. Someone else, feel free. I don't want to be the Mr. Talky Pants here. So, but we're group 5. Everyone had a lot of good points, and I appreciate what the other groups have mentioned there too. And we kind of narrowed it to just a lack of empathy and a lack of partnership. And there was a lot of other elements that kind of, built up to those, but that's what we came up with.
Got it. But no empathy, not showing any empathy, which again leads to no partnership. Excellent.
Absolutely.
Well, I want to thank Bruce Talky Pants and his group for that, because that is, Allison's like, oh my God, but that is a choice. You can intentionally choose. I'm going to use that phrase, Bruce. I really like it. I've never heard it, but I like you. Allison likes it too. Unfortunately, Allison, we're going to have to pay Bruce a quarter every time we use it. Royalties. But oh well. Yeah, he's like, I like the sound of that. Ka-ching. So excellent. Again, not motivational interviewing. I believe we have 2 more volunteer reporters.
Yeah,
Excellent. Go ahead,
yeah.
Marcus. Go ahead.
Oh, yeah, we talked about how, some people said like forceful, aggressive, maybe pushy, different words like that. All probably mean the same thing. And then a lack of partner collaboration. And then we said accusing and a lack of understanding, like different stuff like that.
Fantastic. Again, I want to underline your skill as the volunteer reporter, Marcus, because I think that was about 7 things. But that's okay. And I love the way he got all 7 of them in. Like, well, these are all just words describing the same thing.
I am dying over here.
Excellent, Marcus. And you really are describing the sort of approach that she used, and it was aggressive, it was pushy. Yes. And I might even say that it was also an example of talky pantsness in terms of expert talky pantsness, right? Because the expert did most of the talking.
Yeah.
All right. Excellent. Marcus, thank you so much. And I believe there is one more volunteer. Yes, go ahead, Kristen.
So our group talked about a lot of the other things that the other group said. The word that we all seem to agree on is that she was very authoritarian, very authoritative, and
Yes.
a couple of people agreed that while she was trying to do her job by explaining the harm of what she was doing and getting her to understand the harm that she was doing, but in terms of motivational interviewing, she wasn't practicing it. She was being very authoritarian, like, this is the problem and you need to stop and these are the reasons. So not working with her as a resource, but telling her that, I know you need to change this.
There's something I really want to underline that Kristen and her group are noting. And Kristen, I love the fact that you kind of included a gesture, because I'm serious. I love it because it really speaks to her vocal tone. Her vocal tone was, this is important. You need to stop. You need to change this. And you know what? I'm going to be an optimist for just a brief moment here, because Kristen and her group mentioned this. I'm going to be optimistic and say maybe she was trying to do her job. Okay? I'm also going to be even further optimistic. Maybe she can't. Paulette's like, don't you believe it? But I'm also going to be, Paulette, I'm going to try and be further optimistic. And I'm going to say, and I know you're going to really be like, no, but I'm going to say this. I would go so far as to say that the dentist possibly even cares about this patient. And her approach is having the absolute opposite effect, because she's not doing the things that she needs to do to create a collaborative partnership. She's not, as was so well pointed out, she's not practicing motivational interviewing. That woman even handed her a solid gold opportunity. Well, maybe I could cut down. And does anybody remember what the dentist said to that? Now, I also have the advantage.
She said, no, you have to.
Yeah, she said, no. Yeah, that's not enough. That's not good enough. You have to. That's not good enough. Now, I mean, clearly you're an astute group because you picked that up. I have the benefit of having seen the video about 700 times. So I remember her saying that very clearly. That's not good enough. You need to quit. And guess what? If you don't, you're going to die. That was the other, talk about aggressive. Talk about like in your face. Now, we have not a whole lot of time left for this part of our conversation today. So I want to ask you a couple of questions, and I'm asking you to answer these questions subjectively. And you basically have, Tanisha says, now that comment was harsh. The one where she threatened death, that, you know, you're choosing basically, yes, you're choosing basically to engage in this behavior. And you said it's your choice, but you're basically choosing to get sick and die. That's a quote, I think, almost. Yeah, and those tactics, you're absolutely right, don't really work. They don't work. Okay. So I'm asking you to respond to these couple of questions with yes, no, or unsure. And I'm going to ask you to use the chat to type this in. And this is your subjective answer, so there's no right or wrong here. But I want you to watch the chat, folks, as people respond to these questions. Okay? So the first question is, based on your observation of the dentist's behavior, did you feel like the dentist cared about the patient or not? Yes. Marcus is like, even before I write it in the chat, let me nod my head. No. Do you think that nada? Do you think that she cared about the patient or not? Now I'm seeing a lot of ends, but I'm going to check. We have 19 people, 20 people have responded. Okay, yes. And Vanessa says yes, too much. Interesting, Vanessa. Interesting perspective. Yes. Yes, she was concerned. Autumn says. Amanda says she took it too personally. Jaime says yes. So some people are saying yes, and some people are saying definitively no. Paulette says she cared about delivering her message, which was quit now. Yes, but she doesn't have proper bedside manner. Okay, all right. So that's question number one. Okay. And thank you for subjectively weighing in on that. Question number two. And again, this is just your take. I'm asking you based on your observation, based on your take. Is the lady with the pearls coming back for another appointment? Don't think about it too much. Just type it in the chat. So far, I'm seeing heck no's. I did just see a Y. I just saw another Y. No, 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 absolutely not. No. Now, I'm very curious. Maybe not. That was very gentle. Maybe not. That was gentle, Thomas. That's very different than N-O in capitals or no way, all in capitals. Okay. So for someone who said no and was pretty quick on the draw and said no, would you be willing to unmute and say why you believe she's not coming back for another appointment? And again, I'm asking you subjectively. There's no right or wrong here. I'm just asking you based on what you saw. Yeah, go ahead, Lena. What would you say?
For me, she just came across as very aggressive.
Yeah.
I understand that. I'm going to assume that she was coming from a place of, I can see that you're doing something harmful to yourself. You have to stop for your health. However.
Okay.
The patient is an autonomous person and they can assert their autonomy however they want. And so your job as a professional in any setting is just to present them all the information, all of the options, all of the pros.
Okay.
But she was just very aggressive and argumentative and was sort of like, I know better because I'm a dentist, was sort of the vibe that I was getting.
Got it. Got it. And thanks for sharing the vibe that you were getting. I love that you're putting it that way, because when we interact with people, we're giving them a vibe. We're definitely giving them a vibe. Sylvia, I see your hand is raised.
Yes, on 2 occasions, the client crossed her arms, like in defense of herself, like, oh, hell no. I don't know what you're talking about, miss. I wanted to say, please excuse me, y'all, but the clinician should have just said, bitch, don't you hear me talking to you? You know what I'm saying? So that's how it came across to me, like, you know.
Okay.
Yeah, sorry, but that's how it sounded like to me. That's how she looked. You know what I'm saying?
Yes, I do. I know exactly what you're saying. And
Sorry.
Sylvia, I just want to be clear. You're also speaking in the camp of you don't think the lady with the pearls is coming back.
Right, she's not coming back. No.
Got
it. She defended herself. No, I don't want to. Not the way she talked to me. No.
Got it. Got it. So after getting that communication from her, and after feeling like twice that she had to physically defend herself before those teeth chomped her, she was like, I'm not coming back. Okay.
You know, she just cared a little bit too much for us.
Say a little more about that, Naomi, please.
She just, you know, I feel like she was really concerned, but I have a mom at home and I have a really large family. I'm good. I'm good.
Okay. So again, Naomi, I just want to confirm that you're also in the camp of that she's not coming back for a second appointment.
No, and I'm not recommending her either.
Did you hear that? Naomi does not recommend the dentist with the false teeth. Yes. And Tanisha agrees with you, Naomi. She's not recommending her either. All right. Now, folks, I have one more question, and then I just have a couple of other things I want to take care of. And I am going to do my best for you. I will keep my fingers crossed that I can do this. It's a little bit of a packed day, but I'm going to try and make this happen. Naomi, thank you for weighing in on that. Is that I want to make sure that I send my colleagues that article, the 10 things MI is not, in case you want to look at that before we see. You don't have to, but if you want to, you're more than welcome to look at it. So I want to make sure you get it before we meet again next week. It's just a resource for you to review if you want to. It's not like if you haven't read it, you're going to be missing anything in our conversation. But it is a really good article. It's brief. It's very user-friendly, and it's written by Bill Miller and Stephen Rolnick. All right, final question, and then I just have a couple of other things I'd like to state before we conclude for our time together today. You are now the lady with the pearls, and I'm asking you subjectively, if you had the resources, because some people have brought up, hey, she may be the only dentist this woman has access to, or she may not be able to change dentists, okay? But what I'm saying is you are now the lady with the pearls. You personally are the lady with the pearls. And you, Marcus is like, Marcus, can I make a suggestion to you? Never play poker, because I know exactly what you have in your hand. So the idea of that you are now the lady with the pearls and you have the resources to get another dentist if you want. The question that I'm posing for you, you subjectively, and you can use the chat or you can nod as some have done already. You can use the chat. Are you going back to this dentist? Are you going back to her? And again, there's no right or wrong here. I'm just asking you to put it in the chat. Okay. So far I've seen one Y and all the rest no's or nopes. And I'm wondering if the person who suggested, and Marcus says maybe, okay. I'm wondering if anybody who said not, and somebody just said, I think it was Tanisha who said, not even if she's the only dentist, am I not going back to her? Okay, I heard that. Juliet says maybe, yeah. So anybody who said maybe, yeah, or yes, would you be willing to unmute? And would you be willing to say about why you would go back? And again, because I want, yeah, go ahead, Clive, please.
Honestly, you know, I don't feel the conversation started out argumentative. I think there was a condition that needed to be addressed.
Yep.
Dentist put out her professional opinion. Yep. And the lady, right off the top, she said she didn't know what the doctor was talking about. Immediately she went, you know, she doesn't smoke. I live in the Bronx. I don't live far from the subway.
Yeah.
Yeah, if the lady, you know, the lady doesn't smoke, right?
Yeah.
As it was stated. So therefore, the once or twice that she does go out and smoke, it should have popped right into her head. It wasn't a mystery to her. So right off the top, she was defensive and I don't want to say argumentative, but she, you know, she was closed. So me personally, would I go back? I mean, once I go home and I have a discussion with my, with my loved one and say, hey, I have a condition it needs to be addressed. And either I'm going to go to another clinician or I'm going to go back to the same lady. And after I realized that the woman was just trying to help right off the top. I mean, and it didn't start off that way. It didn't start off as a bad situation, in my opinion.
Okay, Clive, I cannot thank you enough for framing that the way you framed it. And Juliet, don't lose your thought. I want to underline something that Clive said. And Clive, I also want to acknowledge, thank you for sharing your perspective and the process you would go through in order to go to that next appointment. I want to underline something that Clive said, because I think it's important to note. The conversation did not start off argumentatively. And Clive, you said that several times, and your observation is very accurate. The conversation did not start off argumentatively. Now, I'm going to do my best to make sure you get that article, but I also want you to know that you can watch this video again because it's on YouTube and it's only 6 minutes long. And actually, I'd like to throw out for you as something, if you'd consider it, I'm going to ask you to please watch this video again. And you have Clive to thank for it. Not me, you have Clive to thank for it. Thanks for being a collaborative partner with me, Clive. So, no, the Clive brings up a very good point. The conversation did not start off argumentatively. What I'd like you to watch the video again, and I will do it too. I'm not going to ask you to do something that I'm not going to do. I'll do it too. And what I want you to identify is, where do you think the turning point was in the video? The video is called The Ineffective Dentist. And you can Google it on YouTube, The Ineffective Dentist. And please do not be an overachiever and watch The Effective Dentist, because we're going to watch that together next time. So please don't watch ahead. Okay? It'll be a spoiler if you do. Okay? If you can, watch this video again. And what I'm asking you to focus on is identify the turning point, because Clive is absolutely right. It didn't start off this way. Really well observed, Clive. Where did Juliet go? Juliet, are you still here?
Hi, yeah, I'm still here.
Yeah, go ahead. Juliet, thank you so much for your patience. And I think you were a maybe. So go ahead.
I was just gonna say I was a maybe. The reason I would side with yes is just because I think the dentist is coming from a place. I don't see it as a place of I don't care. I see it as I care a lot. Maybe someone in her life died of something, smoking cigarettes. Who you don't know, but I see it as she cares a lot, so she's being pushy about it. Yep. And because of that care is why maybe. I mean, she is not going about it the right way, but it's definitely not someone who doesn't care. That's not what I see it as. So.
Got it. Juliet, thank you. And again, I think it's important because we need to have both sides on the table as we think about this. Okay?
Yeah.
So thank you so much, Juliet. So let me repeat for the record. The video that you just saw, The Ineffective Dentist, is not, NOT, is not motivational interviewing. Okay? I am encouraging you, and Clive is encouraging you, to watch the video again. Clive's like, can I come back for part 2? Yes, you can. I'm going to invite you to watch the video again, and I'm going to invite you to identify where the turning point happened. Meaning, Clive said, and it was very well observed, it didn't start off in a bad way, but then something happened. And I want you to try and identify that. And we'll start our conversation with that. Okay? So I really want you to think about that for a minute, and I will try and get you that article. I'm going to share my screen briefly once more. We have just a couple of more minutes left together. And I just want you to consider these final thoughts before I say good afternoon and enjoy the beautiful 80+ degree weather. So one thing to consider, and again, I can't thank our two colleagues in the learning community enough for this, is that the most powerful tool that you have at your disposal, and I'm going to actually change this slide in honor of our two colleagues, Paulette and Vanessa, that the most powerful tool you have is your collaborative partnership, which is your interpersonal relationship in motivational interviewing. That sets the foundation for your ability to practice motivational interviewing. It's the most powerful tool you have. All of the early work that Bill Miller did, the early research work, was isolating the ways of being that the counselor brought to the moment that made it possible for them to actually practice motivational interviewing. And it all came down to the power of the collaborative partnership. So we talked about client-centered counseling a very little bit. Again, if you get a chance to look at the article, great. If you don't, that's okay too. But what I want you to consider is that it is possible to be practicing client-centered counseling and not be practicing motivational interviewing. It is not possible to be practicing motivational interviewing unless you are interacting in a client-centered way. And they are not the same things. So that's kind of the final thought that I'd like to leave you with at this particular moment. And I'm going to stop sharing my screen. I'm going to ask everybody to take a nice deep breath and just let it go. Don't take your hands off the wheel, Daniel, if you're driving. And what I'm going to invite everybody to do, just as a way of concluding our time in part 1 together, because we have our part 2 next Friday, what I'm going to ask you to do is I'm going to ask you to reflect, just take a moment and reflect on your experience of part 1 of our time together in the learning community today. I'm just going to ask you to reflect on that. And what's the first word that pops into your head? Don't judge it. Just type it in the chat. The first word that pops into your head when you think about your time in our learning community today for part 1 of this conversation. There's no right or wrong. It's just the word that pops into your head. There's no right or wrong. It's just what pops into your head. Okay. I'm seeing a lot of words. Okay. And again, no right or wrong. It's just your reflection in one word, a moment for you about what your experience has been like. Okay, so 41 people have responded. Okay. Marcus, that's actually a word that I'd use too. But I like this conversation, so, all right. Again, I can't thank you enough for everything that you brought to the table. Have a wonderful and a safe weekend, and I'm looking forward to seeing you next Friday. Take good care, everybody. Thank you so much.